Good evening, everyone. Welcome to BioVanguard Cell Talk presentation. For today's session, Madhuri Bhattacharya is our presenter, and she will be discussing on the topic dietary intake of polyunsaturated fatty acids, the food sources and fertility in females and males, a preconception prospective population-based cohort study. Before starting the presentation, I would like to introduce her. Madhuri holds a bachelor's degree in microbiology from Ramlal Anand College, University of Delhi, and she is in her final semester of master's program in nutrition biology at the Central University of Haryana. Her academic journey has honed her expertise in microbiological techniques, food quality analysis, and the core principles of nutrition science. Through this fellowship, she is looking forward to acquire advanced scientific and research qualities which will help expanding her knowledge base, empowering her to contribute to high impact scholarly publications as well as aiding in thesis writing. Now I warmly welcome Madhuri to start her presentation.
Yes, thank you so much, Uma. So, the research topic that I would be covering today is on dietary intake of polyunsaturated fatty acid and how it is affecting the fertility in both female and male population. So, this is the study which is based on the Dutch population, basically the European population. So, what is subfertility is that it is basically the chances, the probability of conceiving within 12 months of trials and errors that basically affects millions globally due to different reason. Maybe the nutrition is the reason, or maybe the like pollution is one of the factors. So these are affecting the millions globally, and current medical treatments have very limited success to it, and it is very costly, and it causes a lot of burden to both the families and the medical treatment as well. So if we take in the natural way, the polyunsaturated fatty acid have shown a very good result in case of all the different medical issues. So one of the factors that is being researched is in case of fertility. So essential nutrients from diet, which are main sources of polyunsaturated fatty acids, are seafood, nuts, seeds, that have the chances to increase the fertility through roles in reproductive process. It affects the different processes like ovulation, implantation, and sperm function. So general dietary guidelines states that around 2 mg of polyunsaturated fatty acid, omega-3 and omega-6, must be consumed in a week. So depending on how they are being consumed, it affects the fertility. So that is being taken in their focus. So research is being done in dietary PUFAs and human fertility, but the data is not so clear about it. Like they choose little bit of factors, there are different factors they are not considering, and there are various reasons there is a very limited data. So this is basically taking an account of fecundability. Fecundability is basically the term used of the chances, the probability of consuming within 1 month. So in the general population, and especially in males and females both. So the background of the research states that how this research is being used is that omega-3 has shown a very good result in reducing inflammation, and it supports endometrial receptivity as well. That is how the endometrial lining is supporting the growth of the embryo. So that is being influenced by omega-3. And while omega-6 has the contribution to ovarian steroidogenesis, that is the release of the different steroids that affect the growth of the embryo in the womb, the mother womb. And but the high amount of omega-6 may cause pro-inflammatory effect as well, so that has to be in consideration. So sperm also require a high PUFA content for membrane fluidity, and it is again essential for fertilization. If we take in account the ratio of omega-6 and omega-3, so that has also been a very important issue that has to be considered. So it has been shown that lower omega-6 to omega-3 PUFA ratio has been associated with improved sperm quality. So these are the different research that has been already done. So in this paper, they have been considered the population, and mostly previous studies have only taken the fact that infertility treatment and limiting the generalizability for that. So the objective of the paper is to investigate the association of periconception dietary intake of PUFA-rich foods and omega-3 and omega-6 PUFAs with fecundability and subfertility in both female and male population, and to explore that how they are being affecting to the fertility chances directly, and to provide evidence for potential gender specific dietary interventions, if there are any, that the gender specific relation is there, that may support in future prospects as well. So how this test is being done is they are basically taken a test study sample from Generation R Next study, which is basically based in the state of Netherlands of Rotterdam place, the name of the place is, and it is based in Netherlands. So this study group is basically taking, they have taken more than the male and female population, which is more than 18, and they are in reproductive age, and there are different factors they are being taking, and they basically study how fertilization, how fertility rate is being affected directly, the different factors that are being taken. So they have taken from this study group, they have taken 830 females and 651 males who have contributed, who have volunteered for this study, and their dietary, and further they had their different means the dietary intake and their different like age, different factors have been measured, and their dietary intake is also being analyzed using the food frequency questionnaire. And PUFA-rich foods are being assessed using the seafood, like the lean meat they are being consuming, the fatty fish they are consuming. So those, and how the frequency is there, like if they are taking it in once in a week or twice in a week, how is the frequency they are considering that, and the dietary PUFA intake is being assessed on the basis of that, and statistical analysis using Cox proportional hazard and logistic regression. So further, this is the data that the characteristic, that table is little small, but you can see that the different characteristics being assessed, the age, the gestational age, ethnicity, that they are basically based in the Dutch population. And the association of periconception seafood intake with fecundability and subfertility risk is being assessed as well. So it is basically based on the how the food is being consumed and how it is influencing the fecundability and subfertility risk. And there are separate models and there are combined models as well for the couples and as well as for the individual population. So what the results state is that fecundability, which I have already defined, is the probability of conceiving within 1 month, and subfertility is within the 12 months or use of assisted reproductive technology. So what the results state is that in female population particularly, the higher omega-3 PUFA intake, which is especially DHA and ALA, was associated with increased fecundability and reduced subfertility, which is a very positive result that yes, the fecundability rate has increased and there is reduced chances of subfertility. That is, this is directly influencing the fertility rate. And omega-6, while omega-6 have not shown that much clear association, and lower omega-6 to omega-3 ratio is linked to higher fecundability and lower subfertility risk in female population particularly. In case of male population, if there is high intake of nuts and seed but not the seafood, that is associated with increased fecundability and lower subfertility rate. But there is not a significant association. Here is a chart. Basically, it is showing that how the increase of the population, how the increase of the time the frequency is being increased. Depending on that, the rate of subfertility has reduced by the time. So this is showing that the first two chart is for female population, then the male population, individual population, and then the couples, that how their fertility is being influenced. So this is showing a superimposition of the both the charts. So this shows that there is a positive result. Further, this result have shown for the adjusted and unadjusted models depending on the factors they have chosen. So on basis of that, the odd ratio is being calculated and subfertility, and it has shown the quite similar results. So the conclusion of the paper will be that findings support the potential for gender-specific dietary interventions to enhance the reproductive health, because we know that reproductive health is a very important factors that nowadays we are being facing, like how the East Asian population have very low population rate. So this study have shown the positive results, so we can consider it. So this study can further influence that how these AI models are being generated. So they can include like how the health factors, there are different tracking apps, like during the pregnancy the female population can check their like how the diet they are taking. So based on that, they can include this factor also, that if they are consuming the nuts, the seafood, and the omega-3 is as per the recommendation. So the omega-6 and omega-3 ratio is also plays a very important role. So these factors need to be maintained, and further this can be included in the future data as well. So further research, what they can explore is the mechanism that how this has been influenced, and confirm the findings in diverse population. Like this is basically for the Dutch population. So further in different population, how they can use, and further they can use it for dietary recommendation for the couples and individual population as well who are trying to conceive. So that is all from my side. Thank you so much.
Thank you, Madhuri, for the presentation. Audience, now if you have any queries, please type them in the chat box. Okay, I don't see any questions. Thank you, Madhuri, for the presentation, and I thank everyone for attending the session.
Thank you so much.